Dr. Thayn, thanks for coming on our podcast.
I love it.
I've been looking forward to this for a long time. Mostly, hopefully we can stay professional. You and I can go off on so many
Either
tangents.
direction.
It's going to be great. So you own Reflex Chiropractic, right? Before we jump in, I've got a bunch of questions for you, right?
Okay.
Before we jump into that, I want to hear about your background, okay? Your background's different than maybe your typical chiropractor, right?
Okay, so short, condensed background. I have a master's in sports medicine, so I love the rehab side of it.
Was that first or after doctorate?
I actually did secondary. So
Okay.
I did my doctorate in chiropractics, and then I got on with a group of soccer players and was like, I really like this. So then I shifted over and went back and got my master's in sports medicine. And when I first got out of school, I was like, I love doing sports. So I went to Colorado Springs and interacted a bunch with all of the athletes out there. So everything from, I worked with a little bit with the Olympics Training Center. I worked with a bunch of MMA fighters. I worked with some minor league baseball teams. And I was doing a bunch of athletes out there. It was a ton of fun. Came back into Utah and ended up in Moab, Utah. Totally awesome place. I recommend everybody visit. And there, it was all rock climbers and mountain bikers and all of the extreme sports. You know, yoga paddleboarding and whitewater
awesome.
rapids, and it was awesome. So I worked with a ton of athletes there as well.
And this was after your doctorate?
After all, yep.
After your master's? Mm-hmm. Okay, cool.
And so I'd been out of school for about 2 years at that point, where I'd ended up coming back from Colorado and hitting Moab. And then I came back into the Salt Lake Valley, and I've done mostly auto accidents and injury cases, where whether they're injured at sports or they're injured in the car or whatever, it all intercorrelates.
See, and I think that's what is so unique. How many people go and get a doctorate degree and say, I want more schooling, right? You have to be a little bit crazy. No, I think it's fantastic. Just what a service to your patients, to your community, to say, I'm going to keep layering on more education and more experience. And then when you think chiropractor, what's the average person think?
Well, that's a hard question because I don't really know.
Well, you're not the average person. But most people think an adjustment, right?
I would say the average person that walks in the door that doesn't kind of know my background a little bit, they come in and they're like, well, let's get adjusted and he's going to work on my spine.
Yeah.
Is what I would say the average picture is.
And there are chiropractors, and that's all they do, and that's fine, right?
Yeah,
and I think it's valuable for people to specialize in things. But I think what makes you so unique, and what I'm just trying to set you up for before you get to answer all these questions, is your unique background, where you say, I treat the whole person. And what I've noticed as you've worked on me is that you look for correlations between every part of the body, right? You're looking at how the foot moves and how that affects the hip or the knee or the neck.
Yeah.
Instead of your neck hurts, treat the neck, right? Or I'm a chiropractor, I treat the spine. It's I treat the whole human and bring that full picture.
I would agree with you 100%.
Which I think is super valuable.
I love it.
Right? And so chiropractors in general, there's a wide variety, and I think it's really cool to talk to a chiropractor with a sports background. And by sports, I mean muscles, alignment, movement background, which aligns really well with physical therapists, right? And what we do. So I think that's fantastic, and it's such a cool background for you to bring to your community, right? What has been the biggest thing for you as you've got that background and you're trying to work with physical therapists, massage therapists? Where do you see that the most beneficial because you have that background? And what are the hiccups? What stops you?
Probably the most beneficial stuff is that it makes it so that I can see different points of views. And so just like you said, I can come in and say, okay, well, my background in chiropractic is really focused on joint function. It focused on diagnostics. And so I can say, okay, well, diagnostically, we're looking at all this medically. And then I can come over and say, well, musculoskeletal, when we're looking at the muscles, my master's says, okay, well, this is a strain sprain, so the component of the ligament and the muscle, and then the chiropractic part of me looks at, is there a structural issue in the joint? Is there something deeper? Am I looking at, was there a weakness in the bone and what caused that? And so it gives me those two different points of views, so I can come in and say, let's refer here so that we can get multiple people on board, and it allows me to refer very, very effectively.
I think that's cool. Your background lets you see the whole problem and understand it, but maybe like you don't want to spend an hour massaging somebody because it's not your specialty or even, and you could, right?
Yeah.
You've got the training.
Yeah.
But it's just not what you do. And so you're able to collaborate and work with people. And what my favorite concept in the world, and I'm sure I've talked about this on almost every episode, is delegate and elevate. So when you hand off the massage part, you're elevating a massage therapist to do that part because they can't diagnose like you do. When you hand off the rehab part to a PT, you're elevating a PT to be involved in that case with you as partners, right? So I'm a huge fan of delegate and elevate. I'm going to do what I'm best at and what I enjoy the most.
So I would tweak that just a little bit, because it's not about the PT, it's not about the chiropractor, it's not about the massage therapist or the MD. When you refer out, you absolutely elevate, but it's the patient and it's the patient's care. So you utilize everybody's top skills, which gives the patient the ability to recover the fastest and most efficient way possible. And so in elevating and referring and elevating and working with the physical therapist or working with the massage therapist or working with the medical doctor with doing injections, it's elevating the recovery of that individual patient.
That's beautiful.
And that's where I would say anybody in medical care, anybody in care of the human body should focus on elevating the recovery of their patient. And it's not about me. It's not about them. Well, it's not about any of the people they're seeing. It's about them.
Yeah, I love that. That's really well said. One of my friends said it, that the patient's driving the bus and invites us onto their bus, right? And kicks people off when they need to move on to a different provider or whatever, or puts you in the back seat while somebody else is in the front seat with them, right? So I like that you're elevating the patient to fastest recovery, full recovery, right? That's fantastic. That's cool. So what have you seen in your career, in the way that you treat patients, that guides you to learn more, to continue to improve?
Well, that's easy. My patients drive it.
Okay.
And so anytime I have somebody come in that has any problem, even if it's come in, they're like, oh, my neck hurts. What is the newest and most efficient way to help them recover? Is the newest way the best way, or is the old way the best way? Because sometimes the old way is the best way.
And then we come back out. Yep.
And so my patients drive what I learn. And so if I have a bunch of patients that come in that are experiencing heart issues during COVID, I saw a ton of endocarditis that would come in my office. Do I treat endocarditis? No, I do not. But I saw a ton of patients who were having the inflammation in the heart, and they were having a bunch of issues with it. And so I had to do a continued education to say, okay, how can I affect that? Does the nervous system matter in that injury? Well, absolutely. The nervous system matters in every injury. So what areas can I treat that will facilitate that recovery? How can we accelerate the recovery? So you send them out to a cardiologist and they do an evaluation and they say, well, here's the medication. How can we help heal that faster?
Yep.
And so anytime that I come across a case where I'm like, oh, this is kind of a weird case, or I haven't seen this in a minute, I go back and either take continued education classes, or I go back through online, or I go through and research and relearn proper treatment protocols for that's current. And I don't just look at chiropractic treatment protocols, because that's not proper. That's not full treatment. I won't say that it's not proper. It's not full treatment.
You need the whole picture.
You have to have everybody involved.
Yeah, you got to look from different perspectives. I think that's really cool and humbling. I think one of the biggest things is for PTs, chiropractors, PTA, whatever your career is learn what you don't know. And then, and that's in your own profession, but other professions, right? Like there's a doctorate, a cardiologist exists because it's science and it's needed. So maybe learn more about what they do and why, instead of like, oh, cardiologist, whatever, right? Like bad mouthing other professions, but explore those other options.
Well, the more you know, the better you can treat your patient, because it's not just about you, it's about the whole group.
Yeah.
And I can treat patients better by referring them out.
Yeah. And how
It's
cool
that
is
easy.
that when you have that abundance mindset to get people where they need to be? And I like what you said, how can I help in my position? And there's two main things that I heard you say was referring out, because you know the right person they need to go see. And with my treatment, how does it affect the treatment they're going to get other places?
And that communication, I think, is super important. Yeah. So if you can get, and just like we have, I can call you or text you and say, I have this patient, this is what's going on, and send them to you, and then you'll give me feedback and say, well, this is what we're seeing is going on. Are we on the same page? And if we're not, why are we not? What did we miss? And it gives you the ability to, again, elevate that care for that patient to a level that they wouldn't have with just one person.
Yeah. So that leads me to another question. You said like there's new things, right? And sometimes that new thing's worse. What is something new that you've seen in chiropractic care specifically, but even if it's in other outside, other doctors, injections, PRP, that has changed the way you view or approach your care?
That's a hard question, because
it's happening all the time.
That's an endless change.
Right.
Each time I shift, and each time I go from, when I got out of school, I focused heavily on athletes, and I focused heavily on recovery. And I did that, and then I came back to Utah, and my dad's a chiropractor, and he focused heavily on nutrition. And so then my focus shift from all this continued education and all this education on athletes and rehab to I did tons and tons of continued education. I probably did 300 hours in continued education on nutrition and how nutrition can affect different heart rates and how and doing that. And so each time I shift or I see an injury or an issue, if I see a lot of them in the office, it kind of shifts how my practice focuses on and what I'm learning to do. Right now, I'm seeing a bunch of pregnant ladies and infants, and so I'm treating a handful. And so now I'm going back and I'm re-looking at, okay, so how do you treat torticollis? How do you treat gassy baby? How do you treat that 2-day-old? I just had a young man come in. He's 2 days old. He's absolutely awesome. They're having some issues with breastfeeding and gas and all of that stuff. And so,
which is more common than most people would realize.
Super common. And so we go in and we're looking at it and we treat the infant. And you treat an infant at that age significantly different than I would treat an adult. And then we spend 15 to 20 minutes having a conversation on, well, how's the mom doing? What's happening there? Is there an attachment issue? And it's not just about an adjustment. It's about, well, here's some tricks. This is how you hold them. I know they showed you how to swaddle the baby at the hospital, but show me what you do. Oh,
yeah.
Well, here's a little trick to swaddling.
Yeah.
And you look at that and you say, okay, I'm doing that. Now I'm going to shift and say, I'm focused on mom. And it's all about bringing them both up to a place where a 2-year-old infant should be absolutely the most amazing thing in the world for the mom. And if the baby's not sleeping, or if they're screaming all the time, if they're that colicky, upset, if they're rigid because they're getting the gassy stuff, that takes that special thing away from the parents.
Well, but people need to know that it's something you can impact.
Yeah.
Because a lot of time, especially when I had my first kid, this is how it is.
Mm-hmm.
And so being that resource somebody can go to and get answers. So one thing that I've learned as I've worked with you over how long have I known you now? 2 years almost?
About 2 years.
Yeah. Is that you really like to help people get better, no matter what that looks like, right? You don't have your boxes. You don't put people in boxes, which I think is super valuable. But you want people to be independent too, where they're not reliant on you to fix all their problems. But I want to take this a different way, because I know you already feel that way.
No, you're totally good.
But what is one thing, or couple, or the biggest one, whatever you got for us, mistakes people make trying to treat it themselves?
This is going to be such a chiropractic answer.
That's great.
I have to smile and laugh. They over-medicate.
Okay.
I know that sounds weird. I see the construction worker that goes and he overlifts and his low back hurts or his mid back or something hurts, and he pops a Tylenol or an ibuprofen and goes and redoes it the exact same thing the next day. And so they're hiding the pain from themselves and they're just re-injuring it. Or I see where they go in and they're like, well, we're going to do a cold plunge. They numb everything. They reset and they get that inflammation all gone, but then they go back and they do the exact same activity that put them in that situation. And so instead of going in and finding a change and actually correcting it, they baby it to the point where they can function, but they don't recover. And so you'll get that grade 1 strain sprain.
That's great. That's a great way of saying it. Baby it to the point where they can function, but they don't recover.
That's what I would say is usually what it is.
That's brilliant. So you're saying like doing a cold plunge and then continuing to drink all your Monster drinks and your Red Bulls to increase that inflammation again might not be the best choice. I'm not thinking of anybody specific.
We're seeing. I feel like there's a trap there somewhere, and I'm not quite sure where it's at.
No, I know you don't drink soda, right?
So my response to that is if you want long-term recovery, you have to make long-term changes.
Yeah, I love that. That's so cool. I think it's fantastic for people to be able to be independent as much as possible and use medical professionals as coaches and guides.
I'd agree with that. Everybody has to own their own medical care.
Yeah.
You own your car. You own what you do with your car. If you oil change, if you maintain it, it lasts forever. If you're that one young lady that drives it for 8 or 9, 10 months without an oil change and you put 50,000 miles on it, you've earned what you've chose your path.
Yep.
And it's there.
Yeah.
You do the same thing with your body. If you use it and abuse it and don't take care of it, well, it blows apart and fails. If you take care of it, it won't.
Yeah. You only get one, so do what you can. So a little off script. This is not a question that you were sent beforehand, but I'm going to put you on the spot.
Perfect.
There's an issue that a lot of PTs have where chiropractors tell patients they need to get adjusted all the time.
Okay.
I want to hear your perspective. I have a different perspective than most PTs, so I'm excited to share mine too, but I want to hear yours first on that concept.
Maybe I should have you share yours first so that we...
You won't offend me.
No.
We can disagree.
Should you adjust a joint all the time? Absolutely not.
Interesting.
So you see all the... This is a great example of adjusting your joint all the time. So if I take and get those guys or girls or kids that pop their knuckles all the time.
Yep, that's what I'm thinking about.
Yep, you pop your knuckles all the time. What does that cause?
I don't know. I've heard a lot of theories.
Well, if I
got my personal opinion, but...
If I take a joint and move a joint all day, every day, it stretches that joint capsule.
Right, joint capsule, the supportive ligaments around it, which creates...
hypermobility.
Which the body's going to
respond.
Creates
instability, and it's going to create arthritis.
Because the body responds with, it's unstable, so I need to tighten everything up and wear everything down.
So it tries to stabilize or immobilize due to a injury.
Yep.
So should you take and adjust the same joint all the time? You should not. That is going to cause injury and it's going to cause a long-term problem.
I would add, who's adjusting it too?
Yes.
Because if you're adjusting your own knuckles, it's uncontrolled, it's chaotic, and you're looking for a sound, not a treatment.
Yep.
So I think if you adjusted one of these people's knuckles as many times as they're doing it, they're going to have a better result than them doing it to themselves because of the skill behind how it's being adjusted. But still not necessary.
I'm going to say no.
Okay.
Because I know how to adjust the joint and take it to its full end range each time I adjust it. So I'm going to take all those ligaments and all that joint capsule, and I'm going to open it up to its max.
Okay.
Where you just taking and rolling the dice and just going,
Yeah.
it might, but it might not. But you're more likely to injure yourself.
Yeah.
So I'm less likely to cause that immediate injury, where doing it yourself has a higher likelihood of you damaging the joint immediately.
Okay.
You should not take and adjust a joint all the time, at least the same joint. Now, going back to what we were talking about earlier, if I take somebody and I put them on a wonderful diet, I just talked about this diet yesterday of chicken nuggets and Red Bull is their diet for the day. That's a super inflammatory diet.
Right.
That means that the joints are all going to be inflamed and they're going to fail more rapidly at every level. So if I took somebody that's on that diet and I take them and put them in a sedentary lifestyle where they sit at their computer all day, they sit with bad posture, they're doom scrolling, whatever they're doing, they're actually causing enough injuries through the spinal column and through the other joints of the body that they can be seen all the time. It's not that I'm adjusting the one joint, it's that you're damaging multiple different joints, and we're playing tug of war on how many joints can you damage and how many joints can I repair and who's faster. And so it's not that I'm going to have you come in every day and say, well, you got this injury, it's right here, it's in your thumb, you got mommy's thumb, because I've been seeing a lot of kids. So you're picking your baby up and you're driving that thumb backwards, so you're getting mommy's thumb here. Let's adjust that. Well, it's already hypermobile. Let's adjust it, put it back, KT tape it, stabilize it, and not adjust it for a couple of days so those joint capsules can heal.
Yeah.
However, you're also looking down all the time. So you're getting injury to your neck and you're setting yourself up for neck problems. So that's a different area I can adjust. If you came in day one and only said, my hand hurts, well, I adjusted your hand. You come in day two and we check your hand and now you say, my head hurts or my neck hurts. Well, that's a different treatment.
Yeah.
And then you used to be a runner, but you couldn't run while you were pregnant because your balance went away. And now you're getting IT band syndrome. And so the third time you come in, you're looking at IT band syndrome.
Yeah.
It's not about coming in and treating one joint 10,000 times.
Yeah.
It's about treating the individual and their whole person. How many times do you run into a person where it comes in and says, oh, I threw my shoulder out? You treat the shoulder and then 2 months later, they're like, oh yeah, and by the way, I got this knee issue.
Yep.
And then you treat that.
All the time.
And then there's an oh, by the way, and oh, by the way. And 2 years later, they throw their shoulder out, but they're still in the middle of oh, by the ways.
Yep.
And you're back to the shoulder. So it's not that you treat the same joint all the time.
Yeah.
It's that you treat the person as a whole, and I can look at it and say, you know what? I've had people come in and I'm like, you don't need an adjustment.
Yeah.
But your diet sucks.
Yeah.
So instead of needing an adjustment,
Let's adjust your diet.
let's adjust your diet. Well, your diet's doing better, but when was the last time you went and actually walked a mile? Let's adjust your exercise protocol.
Yeah.
When was the last time you did something for emotional stability? Let's adjust emotional stability. And if I run into things, and that's where we start getting into multiple people, where you start referring out. I'm not a psychiatrist.
Yeah.
There's so many people out there that are better at that than me.
You'll
But it
get better
affects,
results, better outcomes faster.
Yep. And it affects their outcome physically.
I was just talking to a patient about that yesterday,
Yeah.
where I was like, she came in, has a concussion, said, I need you to go see desert counseling because this concussion recovery is going to be way slower if they're not involved.
Well, concussions are a great example with desert counseling. If you have a concussion and they're depressed and they can't focus and they're going through a divorce and they're having all of these issues, it's just going to amplify the effects of the concussion. And we're back to that tug of war.
Yep.
Your tug of war trying to correct a concussion, but all of the stressors are amplifying, which is pulling the opposite direction. If you get a team, you pull harder and you win.
Yeah, you get it. I like that. You get a team, more people pulling on your side of the rope, but also they're with themselves 24/7.
Yeah.
And I'm with them for 2 hours every 7 days.
Yeah.
Like, that's just not enough time
No.
to win. So, and not enough by not just time, but also different things that are being done for them. So,
And I agree with that. So
I'll tell you, the physical therapists, at least when I came out of school, a lot of PTs talked about like chiropractors are recommending adjustments way too often or whatever. My opinion has grown a lot over the years. I'm a huge fan of adjustments, and I have another beef to pick on that, but I think that often is fantastic because mobility is fantastic as long as there's a big picture, right? I think if you're going to a certain place, which I won't name, the joint, then you're getting adjustments all the time and it's doing nothing for you, right? Maybe I won't dive into that, but you're getting all these adjustments, right? And that's it. What about the big picture? What about your diet? What about your regular exercise? What about, and mobility and stability? I want to be able to move and strong through that movement. So I'm a big fan of it now.
And that's what makes the difference between somebody who hurts all the time and somebody who doesn't hurt all the time, and somebody who takes an injury and recovers slow and somebody who takes an injury and recovers fast.
Yeah.
Is if your body's already moving properly, if the muscles are already toned, if the nutrition's already in place, you already have all that stuff pulling in the direction for recovery. You get a little injury, well, if you have 50 people pulling on one side and one on the other side, the tug of war shifts fast.
Yeah.
If you have 30 on each side, the tug of war never moves. Problems that you have that we go back to, I'm just good enough I can function.
Yep.
Just good enough to function means that you've got 30 people on the wrong side pulling and 30 on the right side pulling. As soon as you add one person to either side, you either start winning or you start losing.
I really like that analogy. I think I need to use that more often because I often with patients, I'm like, man, I want to look good, right? I want to look like I'm helping them and I'm fighting this crazy uphill battle. It's me pulling against 50 people on the other side of the rope. I'm like, man, get more sleep.
Yeah.
You know, can you eat a little bit healthier? Because I want my side to win, the recovery side, and I'm going to get a chiropractor involved and get a counselor involved because there's 3 of us pulling now. I think that's fantastic. So the beef I want to pick, and this is with my profession, and then I want to hear if it applies to you guys at all, is right out of school, heard about acupuncturists, and I was like, terrible. They're horrible. What a hooky, whatever, right? And then I studied dry needling. I'm like, this is a freaking amazing. And guess what? Dry needling and acupuncture very closely aligned. We study all their research. Like, this is so cool. So I'm a huge fan of acupuncturists now. And adjusting. It's like in PT school, we've talked about this. They brainwash you to hate chiropractors. And I've heard some chiropractic schools brainwash you to hate
same
PTs.
issue.
So, but then I went and took courses on how to adjust, and I learned the science behind it. I'm like, this is amazing. PTs can do it the right way. Chiropractors or, whatever. And it's like, why are we so biased against stuff we just don't understand? Like, I'm a big fan of chiropractors and acupuncturists now. I understand it. I've studied it, and my patients get better when they're all involved. PTs out there who are against chiropractors still are just way behind the times, first off. But second off, it's because they're too prideful to actually study it and understand that somebody else might be able to bring value, right?
Value to that. And if I would say, out of all the stigmas that I've ran into in chiropractics, that's the biggest one that I would say needs to go away. And it doesn't apply just to PTs or chiropractors. It applies to the entire medical field. Cardiologists should refer to physical therapists and chiropractors and massage therapists. Neurologists should do the exact same thing, and we should refer back. Everybody has their thing that they're great at, and if you can bring it back, I'm back to that group. If you can bring the group together, it's not about the doctors or the healthcare providers, it's about the patient. And the more of that stigma that goes away, the better the care is for every patient out there. So I'm beating a dead horse.
Right.
It's everybody, the more people you have, the better you can treat. Get a nutritionist involved, get a psychiatrist involved, get everybody involved, because their recovery is faster.
But how do you help other PTs, chiropractors, MDs get over that stigma? There's chiropractors, especially in Utah County, where like PTs are just expensive personal trainers, or they're like, we'll refer to you once they're ready to get back to the gym. I'm like, great, and then I'll refer them to a personal
An athletic trainer,
right?
I'm in.
That's past me. Get me involved sooner. So how do we help more people in our society get over the stigma, like actually learn? MDs, come learn what a PT actually does, because I promise you get here, you're like, whoa, I didn't know you could do that. When I met chiropractors, like really met them, this was like 7 years ago, started meeting, going out to lunch, talking with, I was like, oh, you can diagnose. I thought you just lined up a spine and adjusted it. Like the chiropractic brain is brilliant, very, very smart. And PTs who are still closed-minded and haven't learned that need to go hang out with people like you. How do we help more people? Sorry, I got on a really political push.
There's a big push there, but the easiest answer to that, to round it all into one word: collaboration. What really just needs to happen is if a PT's out there watching, or if a chiropractor's out there watching this, go meet your local PT, go meet your local chiropractor, go talk to your MD, go talk to all of the medical providers or healthcare providers around you. Just go introduce yourself. Now, some of them are going to close the door and be like, no, on your way. But you're going to find that one or two that are open-minded enough to just even listen. Go out, interact, and find what they're good at. The interesting thing is that I've probably seen, that I'm seeing more and more the more I work with different physical therapists and the more I work with other chiropractors, I refer to other chiropractors too. The more I interact with other healthcare providers, the more I realize that every healthcare provider finds their niche. They find the thing that they love. They find, I like treating concussions. I like treating shoulders. I like treating gastrointestinal issues. They find the thing that they like, and they're masters at that. They may be jack of all of everything else, where they're just, but they're masters at this.
Yep.
That's who you want on your team. You want that pelvic floor specialist that masters the pelvic floor. You want the PT that comes in and says, I can do the neck extraordinarily well, but man, I suck at ankles. Well, I'm never going to send that dude ankles, but I'm going to send him necks all the time. Same thing with the chiropractor. How many chiropractors do you know that adjust extremities? I know chiropractors that probably a quarter or half their practice is feet.
That's cool.
That's all they do.
That's cool.
I know other chiropractors, dude, they won't touch feet for the life of them. Guess what? We were all taught how to adjust feet in school. Find the ones that do the things that you're not good at and refer to them.
And collaborate. Yeah. I was presenting at a chiropractor event, and that was the question I got was, I'm a chiropractor and I've gone to these PTs and they all just slam the door in my face. How do I get in, right? And I think that first off, everybody needs to open their door, so that, like, a PT needs to open their door and reach out, so that the chiropractor is like, oh, okay, there's a PT that will not slam the door in my face, right? And we need to get that going. The other thing is, I'd say any patients who are listening, tell their chiropractor to talk with their, I don't know why I still have alarms set. Tell their chiropractor to meet with their PT or vice versa. Make that introduction, help people start to collaborate. There's some really good groups here in town too that are really pushing this stuff.
Yeah.
So it's awesome to see more surgeons, physical therapists, chiropractors who are meeting up, having meetings and saying, let's work together and get people, because there's such a scarcity mindset when you have to keep everybody. But when you have an abundant mindset, you're like, I'm going to run out of patients because I referred everybody to John. That's a bad example because I would run out of patients. But other people, right? Like, they'll come back for the thing I'm good at, right? And so I agree. Let's collaborate.
It's all, the coolest thing about it is if you find people that you can work with, and not only find people that are like, oh yeah, that guy's the best in your neck, they're going to refer back to you because they're going to see what you're the best at. So if you're in the mindset of everybody, well, they're going to see what you do good at, and they're going to refer those back to you because nobody's as good at that one spot as you are.
Yeah.
Find those guys, find those girls, find the people that are the best, and utilize them.
Yeah, I love that. So last question, and then you're going to have to come on again and again and again because we love you too much. We ask everybody this. What does the mint condition mean to you? So if somebody's living the mint condition life or trying to get back to mint condition, what does that mean?
That changes depending on who you're talking to. Because I would look at it and say, well, the mint condition for my 2-day-old is rest, relaxation, and doing exactly what they should be at that time, just growing.
Yeah.
The mint condition for his mom, low stress, loving on the baby,
Getting sleep.
no pain, getting sleep, no pain, moving. So, and I would say that probably boils it all down to everybody. If I have an athlete, what's the perfect condition for them? Moving. If I have somebody that sits on their computer all day and works all day and gets up, what do you immediately do when you get up? You stretch out, you try and move.
Oh, I needed to move.
Yeah. I would say the mint condition for most people is movement.
Spelled MINT at the end.
Yes.
All our shirts say movement, right? I love it. Well, that's fantastic. How can more people find you? You're in Lehigh, Reflex Chiropractic. What's the best way? Website, phone number? What do you got?
Website's absolutely great. So you just Google Reflex Chiropractics, or you can call in. My staff absolutely loves everybody. Website's probably the easiest to find all of the data, though.
I love it. When I come in and see you, I get like 3 texts in the next couple of days. Your staff are like, how was it? How are you doing? I love it. They're just so like, the follow through is amazing. That's great.
Thank you.
Thanks for taking the time to come on. I think our world needs more providers like you. So thank you for sharing.
Absolutely. Anytime. I'd love to come back.